Okay, so let's see. Hi, everyone. My name is Dr. Negin from Marathon Physical Therapy. We're doing our first ever live Q&A today. And so we're very excited about it. And we're just wondering if any technical kinks might pop up. If they do, we apologize in advance. And so I'm here with my colleague, Michelle Merjani. Michelle is one of our team members at Marathon. She is a former college athlete. She is a tennis instructor in the community. And she also just got into nursing school. So I'm going to let her do a quick introduction and want to congratulate her on getting into her nursing program, and she'll tell us a little bit about what it is exactly, and then we'll begin with taking some questions. I do think this being our first one, we might not get too many questions coming in, but we do have some that we captured from people prior to the live call, so we'll go through those at the very least. Okay, Michelle, take it away.
Hi, I'm Michelle. I was born and raised in Great Neck. I've been here my whole life. And about a year ago, I joined the Marathon Physical Therapy team. I've been a tennis instructor for the past 5.5 years, a tennis player for the past 18.5 years. And now I'm continuing my education in nursing. I'm going to be attending Emory for my master's in nursing and then my doctorate in nursing practice. So I'm very excited about that to, join the healthcare field and be more hands-on. So I guess we can start answering some questions.
Okay, cool. Thanks for that intro. So you'll be leaving town soon, right? In a few months or month or something like that?
In about a month or so.
Yeah.
And it's been great being here, in Long Island and coming into the office with you guys every now and then to help out and see patients and, familiar faces and get to talk to people. But I'm excited for this new journey and, to do something that you kind of been waiting a whole lifetime for, to get to those final steps to then, do the career you want and be more hands-on and be, have all that clinical autonomy. So I'm very excited about it.
Nice. And it'll be a good refresher to get sort of back into
school, especially after this pandemic. Doing my last 2 semesters of undergrad at home was nothing I ever expected. It was definitely a challenge, but now I'm excited, that things are normalizing a little and start being back in person and being in a school environment and, being surrounded by people who have the same passions and, have the same likes as I do and interests. So it'll be very exciting.
Nice. Awesome. Great. So we have some questions. Let's see. Let's start with, okay, so we'll start with the first question. The question is, why can I not bend my knee without having pain? So that is a good question. There's a few reasons why your knee almost could lock and not bend like it normally should. So it could be because there's a new injury that's occurred inside the knee. So swelling can make the knee stiff to bend. Also, your muscles could go into a protective spasm, which also creates like a locking of the knee, preventing you from bending it. And those would be the 2 main reasons: an injury to a tissue inside the knee or outside the knee, and swelling as a result of the injury. So best thing to do is to seek out a medical professional or a physical therapist to do a full evaluation on your knee to then give you your next best course of treatment. Let's see.
I think this one is a great question. What is electric stimulation for? So STIM. I feel like so many people come into the office and, we put it as part of their care plan, but they don't really know, what it's for, what it does, the benefits of it. So I think that would be a
Sure.
great one to answer.
In a nutshell, it's a temporary pain reliever. So while the electrical stimulation pads are on your body, it's sending a signal that gets to your nervous system and to the higher centers in your of your nervous system, which is your brain, and it delays your pain signal. So by doing that, it's temporarily shutting off the pain and giving you a different type of stimulus to feel. It would almost be like you pricking yourself with something sharp or pinching yourself while you have pain in that same area. It's going to just distract you from the pain. It's people tend to like it. We use it because people like it, and we use it to temporarily give them that relief. Yeah, good question. Okay, let's see. Okay. I have a question here. After a slip disc, when can someone start physical therapy? Right away. So, I mean, as long as that's the proper diagnosis, you always want to go in and get an evaluation performed without assuming that you know what the diagnosis is yourself. So after a proper diagnosis of, say, a herniated disc or a disc bulge or low back pain or acute low back pain, you can start physical therapy right away. The sooner you start, the better. In the old ways, they used to have people immediately go on to bed rest. So do nothing for 2 weeks, which was probably one of the worst pieces of medical advice. Now we know better, and that does a disservice to the body. So staying active is a good thing. Respecting your body's healing times is also a good thing. And so the answer is right away. Yeah.
I think there's another question someone left, but I'll change it up a little bit because I've always wondered this.
Okay.
What is tennis elbow?
Okay.
And can you only get it from playing tennis?
No. So you can get it from playing tennis, of course. You can get it from, it's funny because you can get it from a sport where you overuse your wrist extensor muscles here, right? And this is the area of tennis elbow. It's the outside part of your elbow. This they call golfer's elbow. This is called tennis elbow. So you can get it certainly from playing tennis because you're gripping a racket, right? And you're activating these muscles. And if you play a lot of, say, an activity, so say tennis or something else, you can create chronic overuse of these tendons, and it results in tennis elbow. Your arm muscles, similar to your leg muscles, if they're deconditioned and you just jump into an activity and start doing it a lot, can lead to an acute episode of tennis elbow. So there's many ways that you can do it. It could even be from your job if you're doing constant gripping and overusing those muscles and tendons.
And someone asked, how do I sleep with tennis elbow pain, or how should I sleep with tennis elbow pain?
Okay, good question. Let's see. So I would say when you have it and it's acute, it's going to be pretty tender over here, maybe even a little bit swollen. So I would say not sleeping on that side or not putting pressure on it. That's the only advice I have regarding sleep positions for tennis elbow. Otherwise, you're gonna care for it like you would any other injury. You're gonna modify certain activities. You're gonna go to physical therapy and let them treat it for you and get it better. And then you're going to, once the pain subsides and the acute episode goes away, and your tendons start to heal, you're going to strengthen the heck out of your forearm extensors. And that's what's going to keep you strong and then prevent you from having a recurrence of it. Okay, let's see. I think I like this one, the knees cracking.
Mm.
That's a good question. So we always get questions on, why do my joints crack? What does that mean? Is something wrong with them? Is this normal? Is it abnormal? So that cracking sound or that snapping sound can be very normal. It's nothing to get alarmed by, nothing to worry about, unless, of course, it is accompanied by pain. So it's the same way our fingers create friction and create a snapping sound. The same thing happens inside underneath our skin along where the tendons rub against something. It can create that cracking sound or that snapping sound. It can potentially indicate tightnesses at the tendons, or some of the soft tissues that help to provide stability near our joints. Kind of like the knee, you have all these meshwork of tissues that come together to almost stabilize the kneecap. So that snapping sound is not like a bad prognosis. However, it might indicate that you just have some tightness that should be worked out, so that it doesn't become a problem later. Okay. This one is a good one as well. Can physical therapy help with motion sickness? So, motion sickness is basically like a vertigo episode. So, what your eyes are seeing and what your inner ear is kind of signals they're getting are creating a mismatch in what they tell your brain. And so it creates that feeling of motion sickness, where you might feel like your environment is spinning, like what people know vertigo to be, or you're kind of spinning inside your environment. I'm just trying to think. Okay, so I'm going to just treat it like a vertigo question, because if you're on a boat and you get motion sickness, it'll subside. It'll go away once you're that you're off the boat. And so absolutely, we do direct techniques to sometimes mobilize. I think it's like common knowledge. People just call it crystals in your ear. So we do a movement with your head to sort of situate those crystals back into their correct location. And that will take away your icky symptoms. And sometimes that feeling of not quite motion sickness, but a little bit of dizziness accompanied by nausea is actually something that could be triggered by issues in your neck and your cervical spine here. So that's something we absolutely treat all the time. I think people who have headaches, chronic headaches, migraines, this dizziness with a little bit of that nausea, I believe they are treated like they should just sort of take a medication and that's it. However, a lot of times if you just release tension in the neck muscles and the cervical spine, that all gets better and it resolves itself. Okay. You have anything on your end, Michelle?
I think one question that would help a lot of people is how important is it to stretch before and after like fitness activities? And does it prevent any injuries? Does it help with anything?
Sure.
I feel like some people don't know the importance of stretching and how much it could, prevent future injuries.
Yeah, absolutely. So if you're talking about like going for a run, or
Yeah.
if you're talking about like some form of let's say even biking, something where it's a little bit more of an aerobic thing versus going into the weight room and lifting weights.
Like cardio.
Sure. Okay. So I would say for any cardiovascular exercise, especially running, you're using all of the joints in your body. Versus a bike, you're just sitting, you're kind of locking out your upper body, and then you're pedaling with your legs, and so it's more hip and knee movement. For something like running, I believe like a dynamic warm up is really good. Just get all the muscles and even your like spine, your legs, your ankles, your hips, all loosened up a little bit, even for 5 minutes. Doing some of that dynamic warm up is very important versus just holding static stretching. So what I mean by that, I know I'm talking in more clinical terms, but so like if I was going to do a dynamic warm up and just kind of loosen up my hips before I run, I might just kind of go and just shift them over one way. I might just do a reach with it instead of just doing like a static stretch of say like my hamstrings. You can't see my hamstrings, but I'm sort of just holding that position like you would when you stretch your hamstrings, you sort of hold it still. So I think doing more of a dynamic warm up always feels better for me. I'll have to touch base and get back to you on what the research says. And then after, say you go for a run or do a hike or do, some biking, stretching is amazing. Your muscles are already warmed up. And so you have a better potential to, get things a little bit limbered up after the activity.
Okay, thank you.
Oh, you're welcome. Let me think of anything that's like a always question. Let's see. I know we get tons of questions all the time. I guess this is not a question, but this is a good kind of my PSA for the day. So a lot of times people get almost kind of like given a bad prognosis just by what their MRI shows, right? So you have back pain, you go to the doctor, you get an x-ray, and the x-ray shows some wear and tear, some degenerative disc disease, some arthritis, and you go, oh, I got arthritis, or, this stinks, and you almost set it up in your head that you're not going to ever feel better. And that just needs to be thrown out the window. It's normal. Asymptomatic joints have normal wear and tear. So for someone who has no pain, say in their knee or in their back, if you x-ray them and if you MRI them, you'll see abnormalities, you'll see disc bulges, you'll see disc herniations. And they've done tons of studies on this to show the percentage of people in certain age groups of how much abnormality there is. So I would say one takeaway from my clinical expertise is don't let your MRI results dictate what your prognosis will be or whether or not you think you'll get better. Always stay positive, always believe that you will. And you got to put the work in. So things don't heal like this. So they take a while to get injured. And so it will take a while also to rehabilitate different muscles or injuries or tendinopathies or whatever. So.
We got one more question. How should I sleep with shoulder pain?
That's a good one. I love tackling this one. So I'm going to assume that when you sleep on the painful shoulder, that's when it hurts. So what you need is not to like plug us or plug PT, but you always need a proper assessment. Get a proper assessment, and most likely that'll show that you have a tight posterior capsule or tight muscles in the back corner of your shoulder right here. So that needs to be stretched and released and worked out so that when you sleep on your side, there's not that constant tension on something that's super duper tight. and causes you pain. Once you release that, you'll find that you're able to sleep on that side without discomfort. So these are all pretty good questions.
Yeah.
They covered a lot of areas. Joint cracking, motion sickness, tennis elbow, electrical stimulation. Yeah, we didn't get too much low back pain stuff, which is like the #1 problem in the world. But maybe next call we'll get some questions on low back pain. It's always good to talk about it and do some myth busting.
Yeah.
Ugh. Um,
I
but yeah,
feel
this
like
was yeah.
maybe one more thing is when a lot of people go into physical therapy, I feel like they want, like, hey, how long is my treatment going to take? Am I going to be here for a month, 2 months, 3 months?
Mhm.
And I think that it's important to like know that PT takes a lot of time,
Sure,
and it should be something that's very, done slowly and effectively rather than rush to just, get it done in a certain amount of time crunch. And
sure.
I feel like you can talk upon that.
Yeah,
I feel like
sure, of
so
course.
many people want to be like, oh, if I come, you recommend 2 or 3 days a week. If I come 4 days a week for, a month instead of 2 days a week for 2 months, will I get like, will it be as effective?
Sure, yeah. That's actually a great question. So coming to physical therapy is definitely a commitment. I always tell people it's kind of like having a part-time job. You have to dedicate certain, set days for your visits. And when you come, we spend about a good hour, maybe an hour and 15 minutes with you. And what was the other thing I was going to say about that? Shucks, it slipped my mind. Um, of course, it depends on what you're coming in for, uh, and we only know how long or how many weeks we think you need physical therapy for once we've done your full evaluation. And sometimes for me, just getting to know, say, a certain a person's injury, right? And so maybe on the second or third visit, as I sort of test out different things each visit, I kind of get an idea of, oh, okay, I think this patient will respond, be done with us in 6 weeks, no more than
Mhm.
that. So sometimes that, initially I don't know, but I know by the second or third visit. And then the other thing is you should feel a difference in how you feel or how you move, um, by the third visit. You should have some bit of difference, right? And then the other thing, piece of advice that I'll give is once you start to feel a little bit better, don't go and conquer the world. Don't go and say, oh my gosh, I feel good. I'm going to just go and clean out the attic or something, it's
Mhm.
like a silly example, but like, don't go and set up a project for yourself. Because what that usually does is your body's still not ready to handle that much load. So it'll just exacerbate the problem. We try to be very vocal about these few tips that I just went over. And I feel like there was something else I wanted to say. Oh, and there's no magic pill. There's no magic pill. I think I think people are, they either come in with like super duper high expectations, which is good. It's not a bad thing. But it's not going to be done, fixed in one visit. Like I said, it takes a certain amount of time for certain overuse injuries to happen, or back pain, or slip discs or herniated discs. It's really, I mean, although sometimes you wake up and you're like, oh my gosh, I can't straighten up, and it feels like it just happened that day, but there's things that led up to it. So it also will take time to rehabilitate your muscles, your tendons, your discs, all that stuff. So
I also think to add on that, it's not, I feel like when you go to physical therapy, it's not all on the therapist. It's a two-way street.
oh yeah,
You have
absolutely.
to do your homework,
Yep.
and you'll have to listen to your therapist and the aides and the whole team at the clinic. And of course, the therapist and the team is there to guide you and help you through it.
Yep.
But, I think it's a nice 50-50 balance,
Absolutely.
of the work that has to be done to get the results you want in, an effective time.
Yep, absolutely. Totally agree. So, well, this was good. This was cool. This was a good first live Q&A. The questions were really good. Please continue to send us questions so that if you cannot attend live with us, we can still answer them, and then you can watch it on either, I think we'll have a link available of the video, but also this is streaming live on Facebook as well. So you can catch the same recording on our Facebook page. And so you can get your answers there. Of course, and always anything, any questions you have, anonymous or not, you can always send them in to us or give us a call. We can always do a phone consult and go from there. But thank you so much for your time. Thank you, Michelle, for
Thank you. Yeah,
being
this was
my
great.
co-host, co-spotlight. And then we'll see you guys hopefully in a few weeks. We're going to try to do this every other week.
Perfect. Thanks, guys.
Okay, thank you. Bye,
Bye.
everyone.